Hello, everyone, wherever you are in the world right now. Thank you so much for joining us today. I'm Jimmy Quinn, President of IOSH, and I'm your host for today's session. IOSH is the world's chartered body for health and safety professionals. Welcome, everyone. This webinar, or this opening webinar of this new three-part series, is where we'll look at how occupational safety and health and all its partners can embrace a new life beyond the COVID-19 pandemic. We've called this series Building Health and Safety Practice for a New World. As we all know, it's been well over a year now since we first went into lockdown. To say the risk environment that us professionals were here to manage has evolved would be an understatement. It has changed massively, big time. We have all had to learn, to act, and to lead very quickly to help businesses and organisations find new ways to safely and safety, new routes to good health. The fact remains COVID isn't going to go away anytime soon. So today we're going to begin to take the new normal by the horns, looking at how we're going to deal with communicable diseases in the workplace going forwards. How are we going to protect against infection? How are we going to stop the spread of pathogens? What is testing going to be needed? What testing is going to be needed, and what's it going to look like? And what will good hygiene practices look like? If all these questions on workplace safety weren't enough, later on in this webinar series, we'll also look at the future impact on mental health. I'm absolutely delighted today to be joined by two highly regarded experts in their fields. But before I introduce them, may I just highlight, and you may already notice this, that we've enabled transcriptions for this session. If you find this distracting in any way and would rather the transcriptions weren't there, you can simply remove them with a click to disable subtitles. So first of all, let me introduce to you a truly global player in IOSH, Dr. Ivanov, team leader for occupational and workplace health at the World Health Organization. Thank you, Dr. Ivanov, for joining us. Next, may I welcome our very own Ruth Wilkinson, Head of Health and Safety at IOSH. Ruth has also recently taken on responsibility for health and safety policy at IOSH. Ruth, welcome also. So, welcome panellists. It is a great pleasure to have you here, and thank you for joining us. The COVID-19 pandemic has brought untold suffering to the world and puts workplaces in crisis. But to what extent should we prepare for new waves of not just coronavirus, but other communicable diseases? Dr. Ivanov, can you give examples of what these future threats could be, please, sir? Thank you.
Thank you. Thank you very much, James. And thank you very much to IOSH for inviting me again to this series of webinars. It's a pleasure to be with you all. And I see in the chat, it's quite global, from Saudi Arabia, from the Emirates, from the Seychelles. And certainly the topic of communicable diseases is purely global. We live in a world that is very interdependent with a lot of movements between countries, inside countries. We started now working from everywhere. Some people work from beaches, other people may work even in the jungle. But communicable diseases, parasites, the hosts of vectors spreading communicable diseases are everywhere. And if I can start by just giving some examples of what we mean when we talk about communicable and parasitic diseases at the workplace, we quickly prepared this absolutely unexhaustive list of diseases, communicable, infectious, and parasitic diseases that can occur at the workplace. And they are distinguished by the mode of transmission, by whether they're caused by viruses, by bacteria, by parasites, and then what are the high-risk work settings and groups. And we have at least three groups of diseases that affect workplaces, the airborne diseases, bloodborne diseases, and vector-borne diseases. And in addition to that, it's not covered in this slide, we have the fecal oral transmission, and that includes also foodborne diseases and other diseases that can be acquired through dirty water and dirty hands. But with regards to diseases that are primarily transmitted through the airborne diseases, we're talking about tuberculosis, influenza, the common flu that affects everybody everywhere. Middle Eastern respiratory syndrome is a classical already airborne diseases. Now we all experience COVID and we know more about respiratory diseases than before, but there's also bacterial meningitis that is still affecting large portions of Africa. And the commonality between these diseases is that they occur where there is a big crowd of people close to each other in primarily indoor workplaces with poor ventilation. And some diseases, for example, the Middle Eastern respiratory syndrome, the first who come in contact with the disease are those who work with animals such as camels. And then a particular high-risk setting is the healthcare facilities, where people come to the healthcare facilities because they are sick and they may be carrying out a disease that can eventually affect the health workers, and then from health workers can go back to patients. So these are very, very high-risk settings, but also for respiratory diseases, any kind of workplaces, they can occur. We see with the common flu, nobody is safe from common flu. Then we have a number of bloodborne diseases, for example, the HIV, hepatitis B and C, Ebola, Rift Valley fever. They occur primarily through direct contact of workers with blood and body fluids. And the most affected groups of workers are, again, the health workers, but in this context, also sex workers, because some of these diseases are transmitted, are sexually transmitted, contact with blood, public transport. In Ebola, we have seen a lot of public transport workers, those who drive the motorcycle, taxi drivers, all of them who transport sick people to the health facilities, all of them, they get also infected, any kind of close contact settings, but also in case of diseases that transmit, that come through wildlife, like as Ebola, hunters and wildlife workers were also affected. We have also diseases that come primarily from animals, for example, the Rift Valley hemorrhagic fever, Lassa fever. These are very, very hazardous situations, very, very severe diseases, and they come through animal workers, slaughterhouses, workers in slaughterhouses in direct contact with meat or blood of infected animals. And a third group are the vector-borne diseases, and there are different vectors ranging from mosquitoes, sandflies, snails that can spread different diseases. And these are just examples of some of the most common diseases, for example, spread by mosquitoes, malaria, dengue, Zika. We had a global outbreak, Japanese encephalitis, yellow fever, and they occur primarily among outdoor workers in areas where these diseases spread, where the vectors can carry these diseases from one person to another, or people who travel, who come from other countries and travel to these endemic areas. Have also leishmaniasis, which is also a severe disease transmitted by sandflies in certain parts of Africa and Northern Africa, which affects agricultural workers, military workers in endemic areas. Schistosomiasis is quite widespread in Asia and other countries, particularly from rice fields, fishermen, irrigated agricultural production. The vector of schistosomiasis are snails that are the intermediate host for this disease. So as you can see, this is just a snapshot of just to give you an idea of how many diseases we have. And the most important is first to know what are the diseases in the local community. What kind of diseases are they transmitted, how they are transmitted, and what are the symptoms of these diseases, and then how to cut the transmission between people, how to cut the transmissions in the community, how to avoid the diseases coming to the workplace, and what measures then we can implement at the workplace, because the measures may differ for the different diseases. For example, airborne diseases, close contacts, crowded, poor ventilation, bloodborne diseases, contact with blood and body fluids, vector-borne diseases, the measures would be on eliminating the vectors transmitting these diseases. That was my introduction. Thank you. Over.
Thank you very much, Dr. Ivanov. And it is amazing the amount of infectious diseases that are absolutely out there and where they can be communicable from. I'm just going to bring in Ruth now. Welcome, Ruth.
Hi, Jimmy.
Yeah, I just wonder. There's no questions in the chat so far, Dr. Ivanov, but I wonder if I could impose upon you both to ask a couple of questions. And the first question I have so far, and please everyone put your questions in the Q&A. But I'll throw this question out to you straight away, please, Ruth. From an IOSH perspective, what would you say have been the major lessons learned from the COVID experience? That's over to you, Ruth.
Yeah, good question. Thank you, Jimmy. And obviously, in relation to occupational safety and health, working operationally within that field myself as well, I think we've had lots of lessons learned across that agenda, from how IOSH can be preventative, preventing the spread, can support the prevention strategies, how we can support with preparedness and response. So if we think about the lessons learned, sort of thinking it through, for me, when I've done sessions on this previously, it's about making sure that you've got good systems in place. So we talk about having occupational health and safety management systems, following the Plan, Do, Check, Act. So this really is the fundamental bit for me, Jimmy. So the lessons learned piece of have your good systems, have that in place, have that preparedness, preventative, think about the people. So thinking about what Dr. Ivanov has just covered, obviously as part of that risk assessment process, looking at foreseeable risk, looking at the different hazards. Obviously, we do cover biological hazards as part of our occupational health and safety remit as well. So think of the people, think of the whole person as well. And I think given the COVID experience, we've changed working patterns, some are at home. What are we doing throughout the work life and also the home life? So think about the whole person approach, is that other lessons learned. So in addition to physical safety, the mental health, how do we support the people? Get the right systems, you need the right equipment, and obviously the workplace needs to be safe as well. And if I can just, if you can indulge me a little bit more, Jimmy, I've got
you take your time.
Bless you. I've got quite a few thoughts on this. So in addition, it's having that good risk management. So again, like I've just said, we need to know what the risks are. That's the lessons learned piece. What's foreseeable? How does health and safety link in with things like business continuity, for example? How do we support those in that arena? Leadership, it's really brought leadership front and centre, being active, demonstrating their commitments, being visible to tackling this, and supporting their staff, enabling work to happen in a safe and healthy manner. So that's another area of the lessons learned, and demonstrating where leadership can sort of step up, and health and safety professionals have also had that opportunity to advise and support in their workplaces. And I suppose that another final piece from me is good communications. So it's been essential. So as we're on this journey of understanding, putting in place control measures, looking at the different change of risk profile, the landscape, getting new research, it's making sure we're using credible information. You know, that there's lots out there. You can pick up information from one area or another, but we need to use credible information. So that's another key lesson learned for me, and make sure that we support individuals by giving them the right information, the right instruction, the right training and awareness. So it's a true holistic, I suppose to summarise, Jimmy, it's that true holistic management system for me. So that the lessons learned in the IOSH world covers all of that. And I mean, we do these management practices anyway. It's just highlighted the importance and the relevance of aligning this with core business and bringing in those IOSH professionals, and I suppose expanding it to the public health elements as well as the occupational biological hazards. So that's sort of my thoughts on it. Thanks, Jimmy.
Oh, and cracking thoughts, and I resonate with a lot of those thoughts as well, Ruth. You know, in terms of this last year, I think my learning, I know my learning curve when I first came into health and safety was very steep after leaving the forces, but my curve this year, we've all had to move very fast, haven't we, and learn very quickly. And yeah, I think your comments, well, I know your comments are going to resonate with a lot of people. Dr. Ivanov, do you have any view?
Yes. How to say this? First, I was happy to hear that biological risks is part of the curricula and training of IOSH professionals, which is not the case for all all professionals who deal with occupational health, occupational medicine, occupational nursing, hygiene, cell ergonomics, psychology. So there are still gaps in the capacities of occupational health experts and people dealing with occupational health to understand what are the biological risks.
Yes, of course.
And when we talk about the major challenge is that it is totally different from dust or chemical. These are living organisms. These are living things that reproduce, that change. People react in a different way to these living organisms. They mutate also. They also have to transmit. This is how they live, how they reproduce. So it is a different enemy that we have. It's not the silica dust that we know how it affects. It doesn't change that much. But these are living organisms that they change. So the first challenge is to understand what is the organism that we're dealing with. And they're very, very different from one to the other. Second, to understand also, as part of the occupational health and safety risk assessment, do we have any kind of communicable diseases in the community? Can these diseases come to the workplace? How these diseases can come to the workplace, how they are being transmitted. Do we have at the workplace something that can attract actually such diseases? For example, having a very, very crowded workplace with poor ventilation, where people are next to each other and then they have to be speaking loudly and they have to yell. And so that is a recipe for respiratory diseases. Or to have a workplace that is surrounded by water and that there is water is everywhere. And there is particularly stagnant water that can attract mosquitoes. And that is a breeding place for malaria and other mosquito-borne, vector-borne diseases. So we have to be able to understand these risks and be more creative in preventing them.
Okay.
If you allow me to add another challenge that I have seen is, yes, how we get reliable information. Now we see with COVID, and there is so much myths and misinformation that even professionals are having difficulties to understand what is reliable and what is not reliable. So we see some measures that are absolutely unjustified, like putting disinfection tunnels and spraying people with disinfectants for COVID-19. It's absolutely not justifiable. And a major also challenge is how we communicate to workers, because all these diseases, there is fear. People are afraid. Fear is driving, of course, protective behavior, but can be also dangerous. So how we communicate and how we are trusted as communicators, and the better people hear from professional with a health background rather than the manager or the CEO about the risks and how they can be handled.
Wonderful. Well, thank you, Dr. Ivanov, and very, very detailed. Before I come back to you, Ruth, just for a short, if you want to comment on this, we've got lots and lots of questions coming into the Q&A. We're sitting at 23 at the moment. I'm not going to get through them all, but if we could just maybe give some more succinct answers now we've got this major question out the way. Ruth, would you like to just take a minute or so just to come back on Dr. Ivanov's comments? Or are you?
I think Dr. Ivanov has aligned with some of those points about the reliability, the data, the misinformation that's out there, and how do we get this and follow that information? That's what's been highlighted. And as I know at IOSH, we've been saying use those credible sources of information, such as the World Health Organization. Anything that's coming out through those mechanisms is useful. And again, as part of the risk assessments, it's important we look at the work environment, the risk profiling, the activities, because it will dictate a bit of the controls to do. And I'll come a little bit on that a little bit later, Jimmy. But yeah, completely agree. And I think we're recognising those challenges, and they're the major lessons learned through this process.
Thanks very much, Ruth. Well, I'm going to put a couple of points to you. I'm going to do 2 questions, one each. Try and be as succinct and detailed as quick as possible, because we've got another couple of questions to go on, but I'm going to give you one each. What I usually do is I read the question to you, and then I will go to one of you while the other one's thinking about their answer. So basically, there's a quick one here. Sean Jackson. Sean, if you just reach out on the chat, I'm sure there'll be a lot of people there that will help you. Sean's asking, this is not for you, Dr. Ivanov, and it's not for you, Ruth. He's responsible for the health and safety in a warehouse in the UK. The UK are relaxing the COVID measures on Monday. My feelings are masks, face coverings are a good method of preventing transmission of the virus. We plan to continue to wear masks. What are other industries doing? What are the other industries in this webinar? So, Sean, reach out, have a look at the IOSH website. There's lots of things on there for you. And if you reach out to your new network that you've got here, that'll be good. If we have any time at the end, then I'll ask Ruth to come back with a point on that one. Okay, Dr. Ivanov, if you'd like to answer this question, please, after Ruth. Dr. Ivanov, this question, I'm going to go to Ruth next, but this question is one. What are the additional measures do you think we need in addition to current measures of temperature check, thermal camera, contact tracing, social distancing, reduced occupancy, working from home, mass quarantine? What other measures do you think, Ruth? So that was for you, Ruth, that question. Dr. Ivanov, I would like you to answer this question, please. How can we as safety professionals bridge the gap between promoting safety in the workplace versus the pushback to personal and civil liberties? One of the biggest barriers I found with implementing control measures was how the promotional activities were presented, most of which was compliance-based, which was not always well received. Can you answer that question for us, Dr. Ivanov?
Yes. First of all, people go to work, expect to be healthy and safe, and it's a duty of the employer to keep them healthy and safe. But as part of all relations at the workplace, the workers are also expected to comply with the instructions given by the employer. And if these instructions and policies have been developed with the participation of workers, it is likely that there will be more acceptance among workers to comply with. So this is the personal liberties certainly are very, very important, but it is also the liberty of one. For example, driving under influence can affect the liberty of someone else to live. So personal liberties and collective liberties and civil liberties should go together.
Wonderful.
So people at work also have the risk to be safe. I do not want to go to work in fear that my colleague who has not taken a vaccine and who has been partying heavily on a close contact settings in the bar comes to my workplace and makes me sick.
Fantastic. Very detailed and very short, but a good answer. Thank you very much, Dr. Ivanov. That was excellent. Ruth, your question.
Yeah, so I suppose just to give a quick recap to colleagues listening about those additional measures for the question that you posed me. I can't remember if there was a specific location, Jimmy, but again, I'm just thinking.
No, not a location. Just
fab. I suppose there's no one size fits all. For me, it comes through that risk assessment, using the guidelines that are there, looking at the risks of, I mean, not just your workplace, who's in it, have you got any vulnerable groups, where is it located? Again, using the information that's available through, and your enforcers, if you're in the UK, what's HSE got, what's the guidelines that are in place? And for me, it is about the actual risk profile at that time. So if we think of, we know some areas, the risk is higher, do you need to do more? Is there also, I'm just thinking of what Dr. Ivanov has just mentioned, I'm also thinking of the communication that you give to staff, that educational piece, encouraging them to take their own sort of personal responsibility on matters. So it truly is a collective control measure piece that's not going to stagnate. It's not going to sit there. You need to be dynamic. You need to be responsive to what's happening around you. So I can't categorically say whether there's others to add to your list that's there, but it's definitely worth keeping that under review, having a look if anything's changed, check guidelines, new research, do you need to add to it, and make sure staff are fully aware of what's on it, because you can have the best written risk assessment with all these controls on, but if they're not happening, the equipment you're using isn't calibrated, everything else, one of those things can fall down. So it really is true collective effort on there, and keep under review.
I think that's a brilliant control, Ruth. A collective effort is a great control in itself. Thank you. I've got a great question for here, Dr. Ivanov, and I don't know if this is someone that you know, but the question comes from Michael Riedeker. I hope I pronounced that right, Michael. I wonder if the World Health Organization will review the process to respond to new diseases. For COVID-19, the disease was first assumed to be not transmissible between humans, then only by fomites, while the airborne route was accepted only very late, despite warnings of experts like me, not me, but Michael. Would it not make sense to first assume the worst and then, once more is learned about disease, reduce safety warnings at an appropriate level? So go right in, do everything, get it all shut down, and then work backwards. Would you like to answer that question, Dr. Ivanov? I hope I haven't put you under the spotlight there.
Yes, this happens when we face new diseases that we do not know how they behave. And as you know, WHO is a member state-based organization, so we have 195 member states. And they decide on how they want WHO to work and what they want from WHO and what power they would give us. For example, they have said that they expect from WHO that when we give recommendations that they are evidence-based. So with regards to the precautionary, everybody can take recommendations based on precautionary principle and take more stricter recommendations. But the recommendations that come from WHO, they have to be evidence-based. So this is what we have been, as a secretariat, we have been asked by our member states. Of course, the recommendations of WHO are for the whole world. So we have to take into consideration the possibility to implement them in different settings. So that's why sometimes they may look like very minimum recommendations, and they are in fact the very minimum recommendations. So of course, countries in different settings can go further, depends on their capacities. Let's just take the example of physical distancing. The evidence shows that 1 meter of physical distancing is sufficient to prevent the majority of cases. And also the feasibility of physical distancing is totally different in different settings. One is in Montana, another is in India. So we have to take that also in consideration. But as we say, at least the more the better. If you want 20 kilometers physical distancing, that's fine. There are no restrictions on that.
Thank you very much.
Same is with regards to the personal protective equipment, masks or respirators, whatever. The better, the better, and the higher quality, of course, is more effective.
Thank you so much, Dr. Ivanov. I'm going to skip past you on a comment, Ruth. I think that was a very detailed answer. I'd like to go to another question I have for you both. But what I'm going to do, because we've only got 30 minutes left, I'm going to come and I'm just going to take the one answer from the one question. So this next question, again, is for you, Dr. Ivanov, and then I'll be coming to you with a question, Ruth. I won't be coming to, unless you really want to make a point, I won't be asking you to make a point on this question. So Dr. Ivanov, taking a global perspective, which work sectors do you see being most at risk from communicable disease in the future? And can you give a couple of examples? I don't know if your examples were in your opening brief. There was a couple in there that I got, but can you give a couple of examples of how IOSH can help them, please?
Well, the first classical is the healthcare sector. And the healthcare sector, there are a lot of communicable diseases, and we understand where a disease, the first time when we have a new outbreak, the first question we ask, are health workers affected? Which means is a proof of human-to-human transmission. So the health sector is the very, very high risk. Another very high risk of communicable diseases, particularly diseases that cross between animals and humans, are the people, the agriculture, and the people working with animals. And we have seen this in the case of SARS, we have seen this in the case of MERS, we have seen this in the case of now COVID. We have seen in the case of Ebola. Other diseases that I mentioned jump from animals to humans. And we are very concerned that these both sectors, both the healthcare and agriculture, particularly animal husbandry, veterinarian workers, they do not have decent occupational safety and health systems, and do not have occupational health services. Wow. And this is a major, major concern. Other sectors that are also affected are any kind of workplaces where there is close contact between workers and the public.
Wonderful. Okay, thank you so much, Dr. Ivanov. That's great. I think that's a great, some great points there, and I'm sure people were scribbling away. I know that Ruth was scribbling away, but Ruth, I'm going to come to you with a really, really juicy question. This one is going to make your day. It starts off with, okay, Ruth, here we go. IOSH professionals know all about helping businesses and organisations to manage workplace risk, but they're not all scientists or epidemiologists. To what extent will risk management require more scientific knowledge of biological hazards as we move forwards? That's question, first part of the question. I need you to be less than a couple of minutes on this, please, Ruth, if you can. And how much technical knowledge will IOSH professionals need to have to manage communicable diseases, and where can they find it? I think that's a cracking one for you, Ruth.
Good, juicy question there, Jimmy. Thank you ever so much. And you're right, we're not scientists or epidemiologists, and Dr. Ivanov mentioned this earlier, that I know certainly in my training in the IOSH profession, I did cover biological hazards, and I know when I've trained others through IOSH managing safely, or managing health and well-being, we cover a whole array of hazards, biological being one of those. So although we aren't scientists or epidemiologists, I think the principles of good risk management, prevention, protection, and the hierarchy of control lends itself to this. So first of all, it's about recognising hazards. So biological hazards, the communicable diseases, they're hazards like any other. So as part of that process, we should be identifying them. Yeah. And I'll sort of bring in that point that although we cover ones of an occupational route, so we know again, we've mentioned abattoir workers exposed to raw meat. If you've got sewage workers, even people who travel will need their vaccinations, the risk of malaria. We do all of these, but we do need to consider also, is there anything going on around where you work? Are there any outbreaks? You know, we've heard about like the Ebola crisis in the other countries. So we do need to be mindful of, are there outbreaks, and not just thinking about COVID, what is going on in that landscape? And I know Jimmy's looking, thinking, come on, Ruth, but I'm still going, apologies. And part of that is and part of that is understanding the modes of transmission as well. So thinking of how the bacteria, the viruses and so on, they can enter the body, cause that exposure, cause that harm. So all part of that good risk assessment process. And do get in expertise. So if you do need to consult with occupational health, medical professionals, I'm even thinking of me in the day jobs previously where I've had public health call me because someone's had TB, been in the workplace, or when I've been advising schools, there have been different communicable diseases going on. What do we do? So do use the support that's available to you. And again, credible information, and keep that horizon scanning up to date. So what's going on? Is there anything emerging? So you can form that preparedness and that response. So wonderful. I hope I've answered that for you, Jimmy, the two-parter.
That was outstanding answer. Dr. Ivanov, would you like to take maybe 30 seconds to come back with a response with Ruth?
Yeah, what we have seen that businesses, workplaces who have access to health expertise from occupational health point of view, they were much better in preparing, responding, arranging. But many small enterprises, small and medium enterprises, did not have any access to any health expertise. So they were relying on the news, on the local news, on Facebook, on Twitter, on any kind of not very reliable sources of information. So it is an enormous advantage to have access to health expertise, because it's only a person who is expert in health can translate all these, can assess all these public health messages in the local situation and the epidemiology, and really sift through the communication and the recommendations and apply them in a practical way in the workplace.
Wonderful. Yeah, great. I mean, that was worth the extra 2 minutes, 100%. Thank you so much, both. Right, there's a question here for you, Dr. Ivanov, but I'm going to answer it for you, if you don't mind. This is a great question, and it's one I can easily answer. Is there any risk of overstating the threat of communicable diseases to workers? No, there's not. Or yes, there is. No, I'm being serious here, Dr. Ivanov. I think that's a great question for you. Is there any risk of overstating the threat of communicable diseases to workers? My answer would be no, but I'm sure you're going to have a more detailed answer for me, sir.
Well, the risk would be to create unnecessary fear and panic, and we don't want that. So the risk has to be very, very precise. We do not want to create panic in the workplaces. People will not come to work. People would be fear, and then that has enormous impact on their mental health also. So, and can create violence and can create any kind of problems in the workplace. So there is no need to create fear. It is important to have a trustful, evidence-based, reliable communication, and it should be two-way communication. It's not only me telling the workers what they should do and I don't hear what they think about.
Yeah, Ruth. Thank you, Dr. Ivanov. Ruth?
I think that's spot on, and I just jotted down the word proportionate there as well. So that proportionate response, and we have seen some of this, haven't we, that fear of going back to the workplace. Will I be safe? What is the risk? So I think we can definitely resonate with the message that Dr. Ivanov has just provided us there. We don't want to create that fear, but it's that well managed, proportionate, sensible risk management. Give enough information so people are informed about the hazards and the risks, like we do anyway, and they can speak to their line manager, raise concerns. How do we support colleagues to work?
Absolutely, and I know we've got colleagues coming back to work in the next couple of weeks, and I was more or less on the train straight away in the first week in April last year. So I'm immune to it, but I can absolutely understand people coming back to work now, sort of 14, 15 months later, that are really going to struggle. Yeah. Okay, brilliant. And I know that in the third of this series, Ruth, we're going to be talking about the mental health issues, and that's all going to feed in very nicely, although obviously it's not nice, but I understand what I'm saying. I think you understand what I'm saying. Okay, so here we go. Okay, this is a question for both of you. How would you assess responsibility? I think we've sort of danced over it a little bit, but it might be a shorter answer. How would you assess responsibility when it comes to infection control and managing communicable diseases? What percentage of responsibility would you say rests with employers, and how much is it down to individual workers? How important is it that each dovetails with the other, and how can this be achieved? And you gave a great answer earlier on in terms of the collective control, Ruth. So I'll come to you first, and then I'll go to Dr. Ivanov.
Yeah, of course, lovely. And again, obviously, when I think of that responsibility, I first think of the legislation when we're talking about, is it employers, is it employees? So a bit of that will depend on the legal framework for the country that you reside in. So obviously within the UK, thinking about the Health and Safety Executive and having controls in place for risks to human health from microorganisms. So, and thinking about the UK as an example here, probably representative of other countries, of colleagues who are also on the line. But there's a raft of legislation where infection prevention and control is covered, from things like our COSH regs, the management regs having risk assessments, food safety is what do we report, public health. So there's a raft of legislation there, so which does put responsibilities on employers, people in control, to implement as per that legislation. But likewise, we also have responsibilities on employees to cooperate with their employer. So for me, it's always that joint responsibility. If we can put controls in place, we need to communicate them, give the findings, and employees obviously need to then cooperate with those that are in place to protect them. So there's this whole raft, this whole remit. And with regards to infection prevention and control particularly, there are standard infection prevention and control requirements. And again, I've come across these in more of those healthcare settings through my career. So some colleagues on the line might not be that familiar with them, but we've definitely been exposed to them through the COVID response, through respiratory hygiene, PPE, hand hygiene. So it's from a responsibility perspective, Jimmy, sort of coming back, it is that joint one for me. It's following that, what we must be doing to support people, to protect people in that workplace, doing all the communication, giving the right equipment. If I go back to my initial answer, looking after the people, is the workplace safe? Is the equipment the right equipment to the right spec? And are we communicating all of that? And then obviously the employees got that opportunity to sort of work in accordance with those arrangements and flag up any concerns as well.
Thanks, Ruth. I'm going to come to Dr. Ivanov just to give a quick response to the back of your question, but that's the questions finished now. But what I'd like you to do, Ruth, I'm going to go to Dr. Ivanov now. There's a question he'd like to answer live after he's made comment on your question. If you'd like to select a question you'd like to answer live from the Q&A and then come back to me, I'll be able to pick it up. Dr. Ivanov.
Right. Well,
in response to Ruth.
Yeah, we see in this COVID outbreak how important is individual behavior.
Mm-hmm.
The whole pandemic has been driven by individual behavior. Sometimes the greed and the desire to be entertained is driving the transmission.
Yeah.
And this is extremely unfortunate. Of course, the employers have to create conditions for healthy behaviors. For example, in the Ebola outbreak in West Africa a couple of years ago, we have seen workers coming to work with fever and taking paracetamol just to go through the thermal scanner.
Yeah.
But they come to work because they are paid by day. So if they don't come to work, they are not paid. So this is already how employers attract unhealthy, sick workers at the workplace and contribute to transmission. So In any kinds of communicable diseases, staying at home, if not well, is the policy that is recommended, and should not always be so simple, having flexible sick leave policies without people losing their daily income, because coming to work and infecting other workers results in business closure.
Got it. And again, a really detailed answer. Very quickly, you're nodding there, Ruth. Is there something you'd quickly like to add? Are you quite happy now to move on? Wonderful, thanks, Ruth. Dr. Ivanov, I have a question here by Fleur Blaine that I think you'd like to answer. In a collective effort, as Ruth mentions, why has, in fact, you know the question, Dr. Ivanov, so would you like to answer that question by Fleur?
Let me see.
In a collective effort, as Ruth mentions, why is the World Health Organization not allowed use of ivermectin? Is it IVERMECTIN?
All right, yes.
And you indicated that you'd like to answer that question.
Did I indicate?
Yes. Okay. It has already been licensed by the World Health Organization and could be a cheap and safe preventative measure as well as the COVID treatment. Fleur's concerned about the reliance on the vaccine. Is this something we should be contemplating, the use of this already licensed one?
Well, with regards to that ivermectin, certainly I'm not. I don't know the answer, what is licensed and what is not licensed. WHO is a big organization. We can check if there is so much concern about this. But with regards to the vaccine, we have always continued to recommend that the vaccines are only one of the arsenal of preventive measures for COVID. First, we are not sure whether the vaccines really prevent the transmission of the disease. We know that they prevent from people getting severe disease and dying, but we are not sure whether they really prevent the transmission from one person to the other. In particular, for some of the vaccines, there are big questions around that. So that's why we always recommend that the vaccines are good. Everybody should get vaccinated. That is reducing the individual risk of getting severe disease and reducing the burden on the health system. But at the same time, we should not be relaxing the preventive public health measures such as wearing masks, maintaining hand hygiene, maintaining physical distancing. So these are the most important measures that we should continue to maintain, because the virus is mutating. There are concerns. It's getting more transmissible, and we do not know to what extent the vaccines are really preventing the transmission.
Thank you so much, Dr. Ivanov. Very detailed again. Thank you so much. Ruth, from Mirza Hussain, who should own any activity decision related to COVID-19? Is it health and safety, security, HR, business continuity, or should it be shared? What is your recommendations, Ruth Wilkinson?
It's another good question, because again, like yourselves, having worked within it, there's lots of collaborative work going on. So the effort is across all of those different disciplines: health and safety, business continuity, facilities, Occ health. But for me, the decision-making process should come from the top, and what that decision is. So from my operational perspective, going through what you're all doing that risk assessment, pulling in the risk profile, the controls, and coming up with the recommendations. It's getting that sign off through the leadership team. And obviously all those different disciplines that you've mentioned have all got a role to play, but the actual decision making should come through that hierarchy, whatever it is within your health and safety policies for those roles, responsibilities and accountabilities, to truly show that visible leadership and commitment. And if you hadn't got it in place, it's a great opportunity to put those systems in place to get representatives from top management involved to really steer that response. So I don't think it's any which one. Health and safety can pull in a good risk assessment, but to do that, we need to also include the specialisms of those different areas that you've spoken about. So I think it needs to be led through that that top management if possible, and everyone else has got, again, that collective effort to that end goal.
Thank you, Ruth.
Thank you for the question.
No, thank you. And Sheena O'Brien, Dr. Ivanov, has said, thank you for the resource, Dr. Ivanov. Is there a different link where other resources can be obtained dependent on the diseases present in the community? If you could maybe put a link into the chat, that would be wonderful, Dr. Ivanov. Thank you. And while you're doing that, here's a sort of question that's going to take you both. I'd be interested in both your thoughts on this, and maybe more towards Dr. Ivanov. It might not be your subject expertise, Ruth, but would you agree that with climate change, we may start to see diseases we do not have now, especially vector transmitted ones such as malaria and Zika? And so, oh, it moved. Oh, golly. Sorry. I'm just going to find it again from Sheena. Okay. Such as malaria and Zika. And so we must also influence companies to act to reverse their contribution to climate change. I don't know if that's all, Dr. Ivanov. I don't know if you have a comment on that one, Ruth, but if you want to have a look at another small question there. We've got 6 minutes left, so we need to be very quick, Dr. Ivanov. Thank you.
Yes, certainly we will see. We know that we'll see. It's already documented. We see the areas where the different vectors are present is changing. I live in France. We did not have the tiger mosquitoes in France, and now it is all the way up to the village where I live next to Geneva. And the tiger mosquito is transmitting, Zika is transmitting, chikungunya is transmitting a lot of fevers. So we will definitely see changes in the diseases. We see floods, and floods also can spread communicable diseases. We see hurricanes, and then we see also epidemics after the hurricanes. So definitely we'll be seeing more and more communicable diseases. And particularly when we interfere more deep inside nature, when we go to the forest, to the jungle, when we start logging inside the jungle, this is where we get diseases. A couple of years ago, we had a big outbreak of yellow fever in Angola that was brought to the city from the forestry loggers workers who worked in the jungle for forestry, and they were not vaccinated against yellow fever. So this is how things happen.
Thank you very much, Dr. Ivanov. Ruth, do you want to come in?
Obviously, I can't add to the communicable disease element that Dr. Ivanov has covered, but just to obviously reiterate that climate change will bring a shift and different occupational safety and health hazards to the forefront as well. So, yeah, you're quite right. We're monitoring this, and we'll be getting information out on it, but it will bring changes, new hazards, risks in different areas to different activities. So without that, Jimmy, I'll stop it there.
No,
Thank you.
Thank you, Ruth. That was another great point to add. And that question came from Mary Charteris. Thank you very much, Mary. Dr. Ivanov, another quick question here, which I think is going to be okay, this is a good one. Thank you, David Selby. I'm not saying that all the questions, we've got 48 questions have been outstanding, but we've only got a lot of time. But I'm going to ask this question. If you can make it quick and I can stop talking, we might be able to get another one in. From David Selby, an approach of vaccination backed up by herd community seems to be the UK government approach. What are the pitfalls in reliance on herd immunity? Dr. Ivanov.
Well, I think our top management has also replied that herd immunity is not something, we're not animals. And herd immunity may be an enormous price to pay, and maybe also purely unethical. So killing people, killing the vulnerable people of our society is not something that modern democracy would sustain.
Fantastic, short and sharp, and thank you very much for that one, Dr. Ivanov. Ruth, I suppose, yeah, exactly. Yeah, I'm not coming to you then. Good. Okay. Okay. Here we go. Let's go to. Okay, one more question. I'm just trying to find a short one. It's probably going to take me longer to find a short one. Okay. One moment. Okay, should we continue lateral flow tests across our business? Ruth?
Yeah, again, this is another one for me. This kind of aligns, if we've at the early start of the outbreak, we didn't have that facility to do tests. You know, I was sort of thinking of, somebody's got a cough, was it COVID symptoms or not? So for me, it is part of utilising what's available with those control strategies. So I'm sort of in that arena, that if we've got some controls at our disposal, then again, where there is that risk of potential bringing something in, if you're in those higher risk areas due to the activity that you're doing, as you're bringing people back into the organisation, then yes, if that is available, it is one of those controls to consider as part of your risk assessment. And again, going through that decision-making process, the consultation routes with employees. So there's it's just got to go through that decision, the risk assessment, and the consultation piece as well, Jimmy. But for me, if it's there, you've got to consider these controls in proportionality to the risk and what you're trying to achieve.
Thank you very much, Ruth. And Dr. Ivanov, I assume you're on the same thoughts?
Well, I think what you call a lateral test, we call it antigen rapid testing. And certainly we also recommend the use of antigen rapid testing in workplaces, particularly where there is active community transmission, where the virus circulates in the community.
Wonderful. Ricky, one last question, and I'm going to go to Dr. Ivanov. Dr. Ivanov, you've got literally a minute to answer this very complicated question. Do we need to be aware of any vector transferred hazards here in the UK now, Dr. Ivanov?
Well, I have visited the UK only a couple of times. I'm not familiar with the hazards in the UK, the vector-borne diseases in the UK. So I would leave that question to Public Health England.
Good, thank you so much. Well, it's now 29 minutes past. In a way, I don't like doing these webinars. I love them because we engage with membership, and we've got over 350 people from our global family listening to these two amazing leaders in health and safety, and part of the World Health Organization, part of the Institution of Safety and Health. And it's been wonderful to hear you both, but it just takes it's too short. We need 2 hours on this. So thank you everyone for the questions. We had 55 questions, over 350 attendees, lots of questions in the chat. It's been outstanding. Dr. Ivanov, a quick summary from yourself. Thank you, before I go to Ruth.
Well, the summary is to get to know what we're facing, check the public health measures. Now, you asked me about the UK, I couldn't reply, but Public Health in England probably knows if there is Lyme disease in UK and whether the ticks in UK are carrying Lyme disease. So check the public health messages, get to know what is in basic infection prevention and control and the principles of infection prevention and control, and really enhance your epidemiology capacities of understanding what are the different curves of epidemic and what are the different levels of community transmission. So that are the simple messages. Thank you,
Dr. Ivanov. And you know, everyone, I mean, I don't want to embarrass you, but please take a moment to see what our fantastic colleague on this webinar has done. And we're so blessed to have him on, to give up his time today. Thank you very much, Dr. Ivanov. Outstanding. And Ruth Wilkinson, quick summary from yourself.
Yeah, just to build on Dr. Ivanov's, really, just review those risk assessments, keep it under review, dynamic, what's foreseeable, preparedness, and again, use information that's at your disposal, really. So check the IOSH website, public health. Yeah, it's all about that information. Is it being proactive, preventative, good risk management?
Outstanding, Ruth, and thank you. And we've got our own head of health and safety for IOSH with us today as well. Thank you so much, everyone, on behalf of all the members that have come in today and everyone from around the globe that's come to the session today. Thank you so much, both of you, and I look forward to working with you both again soon. Take care, Ruth. Hopefully see you soon. Take care, Dr. Ivanov. Thank you so much, everyone, and goodbye.
Everybody, thank you for the attention.
Thank you. I've enjoyed it.
Thank you all.